Hello all, myself Murshida Yasmin, Assistant Professor from SNS College of Physiotherapy. Today's topic is about phonophoresis. Let's get into the topic. Definition about phonophoresis. Phonophoresis is a therapeutic technique that uses ultrasound to enhance the transdermal drug delivery. So in this technique, the drugs which can be applied topically can be used along with the help of ultrasound treatment to enhance the therapeutic effects. So it allows the medications to penetrate deep to the tissues. So in this picture, you can see the transducer head and the skin and the coupling media. So this coupling media is mixed with some medications in need and applied over the skin, and the transducer head is moved accordingly, and with the help of the waves from the ultrasound, this waves will allow the drugs to penetrate into the deep tissues. So the drug molecules get inside the deep tissues and react with the molecules of the human tissue and enhance the effect of the treatment. So commonly used drugs in the phonophoresis are anti-inflammatory agents and analgesics. So it combines ultrasound therapy plus topical medication application. So this is about the phonophoresis. Phono means sound, phoresis means penetrating. So the sound waves penetrating inside the drugs into the deep tissue is called as phonophoresis. So patient with the pain and inflammation cannot tolerate the oral drugs. So they have delayed recovery with the oral drugs. So in case of use of phonophoresis, it provides a localized treatment where there is a actual relief required, and it reduces systemic side effects from the oral drugs. So it is commonly used in sports injuries where there is a need of localized treatment for the strain, sprain and all. So chronic inflammatory conditions also get benefit from phonophoresis. It improves the patient comfort and compliance. So in this picture, you can see the waves transmitting inside, and the molecules are also traveling throughout the membrane, and the drug molecules are getting inside the cells. So ultrasound increases the skin permeability and the cell membrane diffusion. The drug molecules are pushed into the tissues by thermal effects, mechanical vibration of the ultrasound, therapeutic ultrasound. So thereby it leads to faster pain relief and reduce the inflammation, and it is useful where the deep tissue drug action is required. So thereby the phonophoresis is a good choice in treating the localized conditions. So mind map about so far we have discussed. So phonophoresis healing cycle. So it applies the sound waves for the treatment, and it stimulates the cellular activity, and it improves the circulation, thereby elevate the pain and promote the healing. So in what mechanism this phonophoresis works? Ultrasound waves increase the kinetic energy of drug molecules, and it creates a micro massage effect. The stratum corneum layer of the skin resistance is reduced so that the drug penetrates through the hair follicles and sweat glands and results in the localized therapeutic effect from the phonophoresis. What are the drugs commonly used in phonophoresis are hydrocortisone, diclofenac, which is a painkiller, which is an analgesic drug, and salicylate and lidocaine, ketoprofen. These drugs are most commonly used in the phonophoresis. The drugs must be water soluble drug and a low molecular weight drug. So it should be in consideration while using the phonophoresis. So this picture shows you the difference between topical application of the drug and phonophoresis application of the drug. In topical application, the drugs always remains over the skin surface and it does not penetrate inside the tissue. In phonophoresis, the drugs penetrate inside the skin and it gets inside the tissue, and systemic absorption happens, thereby faster relief from the symptoms happen. What are the indications and contraindications for the phonophoresis? Indications: all the inflammatory conditions like tendinitis, bursitis, osteoarthritis, and muscle strain, ligament sprain. So, in case of any sports injuries, phonophorosis is indicated. What are the contraindications? Since we are using the drug directly over the tissue, we should inspect for any open wounds, infections, localized infection, or any malignancy present locally over the application area, and pregnancy over the abdomen especially, and allergy to drugs should ask from the patient. So using a continuous ultrasound with the help of the phonophorosis, increased kinetic energy happen, thereby the tissue gets benefit from the applied phonophorotic drugs. So that's all about the phonophorosis. Phonophorosis can be done when there is a need for the patient with the proper selection of the drugs. Thank you. So commonly clinical indication where we can use for this or rotator cuff, carpal tunnel, lateral epicondylitis, patellar tendinopathy, Achilles tendinopathy. These are the conditions which are commonly clinically indicated for phonophorosis. Hope you have understood about the phonophorosis. See you all in another video. Thank you.